Aarti Prasad is a qualified from Mumbai as a physiotherapist 40 years back, is a musculoskeletal physiotherapist, has been a clinician for the past 40 years, runs classes for the fitness for about 50 years, and has been awarded Lifetime Achievement Award by Bangalore Physiotherapist Network. And she has awarded Women Achiever Award by the Garden City University. Welcome, Dr. Welcome, Arti. I welcome you, and please start your session. I know you are a very, very good demonstrator.
We have always enjoyed Aarti Prasad's thing, and she's too clear, concise, and her opinions are very good. Yeah, Aarti, go on.
Good morning, everyone. Sorry, I sort of was in a rush when Nirja called me up and asked me to start the session. I'm sorry.
Dr. Namita has also joined. That's good. Okay.
Yes, I know. I can see Dr. Namita. The most important thing today I would really talk about is I really want people to understand what is core. What does core mean to all of y'all? Just remember, it is not only the abdominal muscles and the back muscles. जैसे body होता है, you have your body and it's like the trunk of the body. Suppose you remove the hands, you remove the legs, and you remove the head. So what remains is the core. That means you have a core which is stabilizing right from the rib cage till below. Understand that. So this core now by the fitness trainer sometimes is called as the center. It is called as the trunk, and it is also called as the column. We quite a few of physiotherapists, we call it as a column. So what does it consist of? It consists of the lumbo-pelvic hip complex. So you have the lumbar region which needs to be stabilized. We need to stabilize the pelvic region, and we also stabilize the hip region. And this whole thing is called as the core. Why do we talk about core stability? Stability. What does stability mean? Suppose you're standing and somebody pushes you. Then you fall down. If you fall down immediately and go on crashing on the floor, that means your core is not strong. Core is needed to stabilize your body, to bring in balance inside your body, to help you to do coordinated movements with your hands. So this part, this whole part has to be strong so that you can continue with your walking, your running, your working, your being a gynecologist, you delivering. Everything happens if your core is strong. So now, there are certain tests by which you can make out how good is your how good is your core. So what I do in my department is I make them stand and I just push them slightly. If they just go forward like that, that means the core is not strong. Or I push them from anterior part. And if they go back like that, then the core is not strong. This is a very simple test to find out whether the core is strong or not. So the most important point in the core is the core stabilization. So this is extremely important when we talk about core. So there are various movements and various assessments by which we can test. So we can do ask if you're very strong, then we can go further and say do a push-up. We test your push-up. How many push-ups you can do, say in a period of 60 seconds, then you will give a rest of 15 seconds, and again you can this. Or you can do a bridge. How many bridge you can do in a minute? Or how long can you hold that bridge? So that is also important. Then the bird dog. So you go into a crawl position, opposite hand and leg raised up, holding your core in. See that the spine does not collapse, does not become rounded. The spine is maintained. So these are some of the tests by which you can look at the core. Another simple test that you can do for a core is to see how good your core is. It is very simple. All that you have to do is take the opposite hand and leg up, hold it there for 15 counts. And if you can balance yourself very well for 15 counts and then come back again and then can repeat it again for 15 counts, then you can test the core. Now, there are two kinds of core stability. One is what is called as the intervertebral stability. The other one is called as the lumbopelvic stability. Now, intervertebral stability is looking at the activation.
आरती साउंड पे फोकस कर लीजिए, साउंड कम आ रही है.
एक minute, can you hear me now?
Yes, yes.
Am I clear now? Okay, I just moved it to show the exercise. Okay. There are two kinds of stabilities. One is the intervertebral stability and the other one is the lumbopelvic. Now, this intervertebral stability can be done through activation of muscles. Which are the muscles that you activate?
Your sound is still not okay.
आरती साउंड नहीं आ रही.
One moment.
Yes, इस प्लेस पे ठीक आ रही है.
Okay. Now, am I better?
Yes.
Am I better now?
Yes.
Okay, Arti. So, the intervertebral stability is between the small muscles of the spine. There are small muscles. For example, the multifidus. The multifidus goes from one joint to the next intervertebral joint. So this strength in multifidus, the diaphragm, and the transverse abdominis is called as the intervertebral stability. So just by doing abdominal exercises, you're not going to develop core stability. Remember that. So the other stability is called as lumbopelvic stability. What does this mean? That means your pelvic floor muscles, your abdominal bracing, and your hip muscles. All this contribute to the lumbopelvic stability. Now, I'll show you a simple exercise right now so that you can differentiate between the two. So the multifidus exercise, the first exercise that you will really look at is pulling in your pelvic floor. Just pull your pelvic floor in. Remember, when you pull in your pelvic floor, it has to be done mildly, very mildly. Don't suck it in. Just pull it in slightly and brace your abdomen. Just pull it in slightly and brace your abdomen. That is your intervertebral stability. Now, when we come to the lumbopelvic region, what we want you to do is, the difference is this. Can you see the difference between the two?
Yes.
So this is, most of the time, our body needs to be in a neutral spine. So you can't be an anterior tilted or you can't be posterior tilted. We see this very commonly. We see the butt jutting out. So what you need to do is bring it forward. As simple as that. Just bring it forward. So these are the most important things that we have to really concentrate on. Now, what are the best core exercises that we'll really look at? The best core exercises are side plank and planks. Those are the easiest ones that you can start with. Bridging and chest press. I will show you chest press also. I will show you planks also. Do you want me to demonstrate that?
Yes.
Yes. Yes.
Yeah? Okay, I'll do that. So let me show those exercises first and then we'll go further. Can you all hear me?
Yes.
Yes.
Yes. Yes.
So I do a plank. A plank is something that I really like doing. Two types of planks. You can do a plank with your hands straight, with the help of your wrist. Stretch one leg first, stretch the other leg, and maintain a plank. Just maintain the plank. And in this, you can have lot of variations. You can keep moving your leg. You can move the leg to the side like this. And you are balancing the axis. And then, or do mountain running. All these are challenges to your core. This is extremely important. So these are called as planks. Now, if you think you can do it very easily, we'll go further by doing a plank on the elbow. Doing a plank on the elbow. So that will be your progression. Now, you feel you're doing it very well, then you can make it a little more difficult by bringing in an unstable surface. Now, this unstable surface can be a ball, can be a medicine ball, can be a wobbly surface, can be a pillow, can be any unstable surface. So you just hold it like that and do the plank like this. So this is an extremely important core stabilization exercise. If you notice, I'm not doing any movement. I'm doing only stabilizing the spine. What we are really talking about today is how to make your spine stable so that you don't fall. You don't have accidents. And your hands are free, your legs are free to do whatever you want. So this is one. So when you're working in this position, you're working this and you're working this. When you're doing a side plank, I'll show you a side plank now. When you're doing a side plank, this is your side plank, and you can change it. You can progress. You can challenge. In a side plank, what you do is you improve your lateral muscles. Remember, the spine has three movements. One is forward bending, one is going back, one is lateral, one is lateral. Turn, turn. These are the three main movements in the spine. So you improve your lateral muscles when you do the side plank. Now, if you think that is very difficult, then we can just start with simple exercises like this. Come up. Come up. Come up. Come up. Very, very simple exercises. And you can stand and do this. You can stand. Do this for your lateral muscles. You can stand and turn. 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 If you think you're doing these exercises very well, we can progress the exercise by using this, a kettlebell. Very simple. Hold. Hold. This is a 4 kg kettlebell. You can do this. You can do this. And you can hold it like this and pull. The core will automatically get strengthened. Very simple exercises. The core is going to get automatically strengthened. Remember that. Now the next one, if you think the planks are very difficult and what you're doing is very difficult, let me make it more easy for you by doing standing abs. Very simple. Take it up and crunch. Up. Safest mode of doing exercises for your abs. Up. Crunch. If you can see, crunch, 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 crunch. And you want to do your obliques. Up, 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 up. Now remember, these exercises can be done very safely, but in order to achieve results, the number of repetitions that you do should be more. That should be more, because these are very base exercises, and this you will be able to master only if you do more repetitions and sets. Okay? So these are some of the base exercises by which you can improve your core stability. Another important thing that I want to add is, since core is very important for your balance, what I would suggest is sit on an unstable surface. I will just show you how core automatically works. Just sit on it. All that you need to do is lift one leg up. Just lift one leg up and take your hands to the side. Your core will automatically kick in. Lift the other leg, take it to the side, and there you are. You're already doing core exercises. It's as simple as that. If you add a movement, you're kicking in the core more. So you will start with these exercises, do standing exercises, and then progress to something like a plank, hand plank, elbow plank, movements with plank, and then a side plank, so that you cover your whole core more importantly. The last piece of advice that I want to give today is, see that when you are standing, observe yourself, observe your posture. If you are going like this, your core is down. So try to pull yourself up, straighten your whole spine, even when you're sitting. For example, now, I just want all of you all to remember your posture and sit straight so that your core remains in. Okay? Any questions?
Nirja, बोलिए.
I'm looking at all the questions here. So we have a very important comment from Professor Maninder Ahuja, who is our past president of IMS. She says, planks and core are the basis of prevention of falls and controlling it. We have a lot of comments saying how good and beautiful this program is. And what I'm...
Nirja, we should
what
switch
I-
to second speaker. Yes.
Yeah, what I just wanted to ask from Aarti, is there any particular size of ball?
There is one size one.
No,
Now
there
the ball is prescribed according to, I will just show you. It's prescribed to see that your spine remains straight and your hip is at 90 degrees.
Okay.
Your knees are at 90 degrees when you sit. That is one method. The other method is according to the height. So the normal Indian people need to look at 65 centimeters. Anything above the height of 6 feet, you need to look at 75 centimeters. And if you're below 5 feet, then you have to look at 55 centimeters. That's
75.
I see. Thank you. Thank you. I think it's always
Thank you, Aarti.
to have Aarti Prasad with us, and we have repeated her with us. She's a repeat offender. And
आगे भी आपको रिपीट करते रहेंगे. आरती कंटिन्यू किया तो.
because for all the people we have had, that sometimes it works very well, but we have found Aarti Prasad to be one of the most clear and concise, and I'm very, very grateful to you, Aarti. You have always been available for our society, and the people who log in a lot of times just to hear you. And so with that, I think
I'm honored. I'm honored.
it's true.
Thank you.
So,
Have a great day, everybody.
Thank you, Arti.
Thank you.